so much for tuning in to Wellness Wednesday on KBTV. I'm Dr. Karlisha Booze, and today we're talking with Dr. John Mix. He's a vascular surgeon with Atrium Health Navicent, and today's topic is American Heart Month. And so, Dr. Mix, can you briefly just talk to us about American Heart Month and why is it so important for us to, just honor, just recognize the heart and how important it is?
Okay. Well, first of all, heart disease and heart attacks are one of the largest killers of Americans, especially with males. Males, the leading killer of young males is trauma and, car accidents. And second, after that, and when males in the 40s and 50s, sudden cardiac deaths are the second leader of mortality. So there's so much that we cannot control with cardiac disease. A lot of our risk factors for cardiac disease come in the form of family history. There's genes passed down from your parents, but there are things we can control, and a lot of us don't focus much on what we can control. But as far as lifestyle modifications and healthy eating and exercise, those are things that we can do to help us. So Heart Month is to spread awareness for trying to do the things that we can do to help ourselves.
So I know you mentioned about some of the things that we can do to help ourselves, as far as exercising, eating healthy. What are some of those healthy foods do you recommend?
In general, we should probably do whatever we can do to have a low-fat diet, try to focus on eating lean meats, whole wheat, grains and breads, a lot more vegetables. We should probably all follow a Mediterranean diet and have a lot less animal fats and things that promote inflammation in our body. So things that are healthy are really vegetables, fish, chicken, a lot less beef, and try to cancel out all fried foods and things that will increase inflammation in our bodies.
Okay. Now, I know you mentioned earlier that heart disease is the #1 killer in Americans. So are there any symptoms, can people catch it early before it's too late? Are there any symptoms that, people should know about and, be able to consult with their doctor if they have any of those symptoms?
With heart disease in men and women, one of the first symptoms, I believe, is people can have some fatigue, shortness of breath, chest pain, chest pressure with exertion. So in early stages of heart disease, those are the symptoms. As they progress, people could have constant chest pain, and those are all even more alarming. But sudden onset of severe crushing, mid-sternal chest pain is pretty much, pathognomonic of heart attack. So those are the things that are common. Females can have more atypical symptoms. They can have jaw pain and shoulder pain and pain that radiates down in arms. So those are more atypical symptoms that women can have.
So do you see this in mostly older adults or younger adults, or does it vary?
It varies. It varies. I think that we start to see cardiovascular disease present in younger males and females, currently. It used to be an illness of only older people, but we're seeing it more in young people too.
Okay. So Dr. Mix, before we go, what would you recommend that people do just to pretty much stay up to date on, their health? Obviously regular checkups, but what are some more things they can do before, it's too late?
Yeah, I think regular exercise, 5 days a week, 30 minutes of like, calisthenics or walking or something like that. I think when males and females, hit age 30s to 40s, it'd be a good idea to have a screening exam with their primary care physician and just kind of see where they're at as far as risk factors their weight, their exercise, get your cholesterol checked, and then have an assessment of your family history, just to kind of see where you are with your overall risk. And if you have more risk factors, based on your family history, then you should have a heightened awareness that, that you could be someone that has heart disease at a younger age. So those people should have a more heightened awareness and suspicion than someone with no family history.
Gotcha. All right. Well, thank you so much, Dr. Mix, for coming on the show and just sharing these helpful tips and information. And then I hope everyone will take this very serious, not only for the month of February, but, for the rest of their lives. So again, thank you so much.
All right. No problem. Thank you.
Mm-hmm. Are you a homeowner, a parent, or own a business? What happens to those assets in the case of death?
Hi, I'm Cassandra Barron, your local life insurance agent. Life insurance protects your income in the case of death. Call me for your free quotes today.
Affordable coverage for the whole family. Immediate coverage, no waiting period. Multiple kids coverage for one price. Call Cassandra Barron today.